Literature Library.
Hello, and thanks for staying with us. We appreciate you joining us for the Literature Library.
Well, Jeff, I have missed doing this segment, but you know what part I really miss?
No, Sharon, what part do you really miss? I'm sure you've missed my intellectual prowess in evaluating the literature, haven't you?
No.
No?
No.
Oh.
Actually, I've really missed our friend, the Lit Crit.
Well, you know, I miss him too. He's missed a couple episodes, but you know, he's wonderful to work with. He's just a great and amazing with the literature. However, he's not here again today, Sharon.
Oh, he's not.
No. This time of year is a busy time for our Lit Crit. You know, he volunteers with that jolly old elf at the North Pole.
Oh,
Mr. Kris Kringle, none other than Santa Claus himself.
Wow, I didn't know that. That's wonderful.
Yeah, it really is. Well, I do have some good news for you, however. He wanted to say hello to you. He wanted to wish you and our viewers a Merry Christmas. So he's agreed to Skype in from the North Pole here. And, oh, I hear he's there now. Hey, Lit Crit. Hey, how you doing?
Hello, Sharon. Hello, Jeff.
Hi, Lit Crit.
I am so truly sorry that I cannot be with you today in Milwaukee. But I have been busy helping Santa Claus getting ready. We are wrapping presents and loading them into his sleigh for delivery to all the good little boys and girls on his list.
That's a lot of work.
Sharon, you will be very pleased with your present. But I am sorry, Dr. Jeff, it appears that you did not make the list this year. Well, back to work. Merry Christmas to one and all. Much health and happiness in 2013.
Oh, Lit Crit, thanks so much for joining us, even if it was by, electronic remote, the wonders of Skype. But Merry Christmas to you, Lit Crit. Do a good job. And would you please check that list again? I am positive I made it. I
don't know about that. I think he might be correct. Well, I think we better get to the business of today and look at the article that we're going to review. Today's paper is entitled Pneumatic Compression, Physiological and Clinical Basis to Improve the Management of Venous Leg Ulcers, and it was published in the Journal of Vascular Surgery in 2011.
Yes, it's a great review article. The author of this paper was Dr. Camerata. He is from the Jobst Vascular Center in Toledo, Ohio, at the Toledo Hospital. He's also an adjunct professor in surgery at the University of Michigan. And this review was supported in part by the Conrad and Carolyn Jobst Foundation, located in Toledo, Ohio.
This is a review article which discusses venous ulcers, the etiology, pathophysiology, and then goes into the discussion of the current literature regarding compression therapy. The paper focuses on the use of intermittent pneumatic compression therapy.
Well, that's great, Sharon, because, you know, intermittent compression therapy, pneumatic compression therapy is the topic of this show. So this is a very appropriate article.
Very good.
Fits in well. You know, an interesting section of this paper is summarized in Table 1. The details in this table are the physiological effects that have been reported in the literature and are reported to be associated with the use of intermittent pneumatic compression. I found this incredibly interesting, Sharon. If you look at the table, they talk about, you know, hemodynamic, they talk about hemostatic, fibrinolytic, tissue oxygenation, perfusion, edema, and how this is positively influenced by intermittent pneumatic compression. You know, this clearly finds that what has been talked about earlier, that these are inflammatory ulcers, these venous ulcers, and how that this inflammation can be downregulated by compression therapy. And in this case, intermittent pneumatic compression, I think is very interesting.
This is interesting. The authors review 7 studies.
Right.
Table 2 demonstrates the clinical studies which demonstrate improvement in ulcers healing when IPC was added to routine care.
Right.
Although some reports were inconclusive, a review of their methods reveal a disparity in IPC protocols. such as the pressures, the cycle time,
Right.
and which obviously made it very difficult to compare one treatment regime against another.
Well, not unusual, Sharon. When you put, try to do a review of multiple studies, you're going to
Right.
find inconsistencies in the methods, and so that's not unusual, but nonetheless interesting. Most of these studies were reported before the guidelines for reporting outcomes of venous leg treatment were published. And clinically, we are obviously concerned about the importance of complete ulcer healing, but as everybody in the audience I'm sure is aware by now, current guidelines suggest that we should focus more on healing rates, healing
Right.
trajectories, and percentages of healing. The reported data suggests that the use of intermittent pneumatic compression as an adjunct to sustained compression may be the optimal choice for treating patients with venous leg ulcers. However, a number of questions remain with regard to its optimal use.
Indeed, for example, it is not clear whether these advances to this particular type of compression,
right.
so we're not quite sure what the advances are for this. However, it seems clear that rapid inflation is superior to the slow inflation, and that IPC cycles at 2 or 3 times per minute are superior to the cycles versus 2 to 3 minutes. And then application of the device in the number of hours, again, looking at 3 to 4 hours seem to be superior again then to the application of a shorter period of time. It seems intuitive that the longer the application time per day, the better the outcome should be.
So more rapid compression, more frequent compression, and longer uses of compression.
That,
I agree.
That 3 to 4 hours seems to be some of the key in some of the studies.
It's clearly intuitive. I agree.
Right.
Although the healing of an ulcer is an important endpoint, preventing recurrence, or ideally preventing the ulcer from occurring in the first place, should be viewed as optimal treatment. Proper, sustained compression is important for the healing of ulcers and preventing reoccurrence.
Right. Although compliance with IPC protocols has not been an endpoint in previous studies, data does suggest that patients may prefer IPC to sustain graduated pressure. Ultimately, healing and preventing ulcer reoccurrence with improvement in compliance with compression therapy is enhanced. We know that. We also want to point out that the adjunct use of IPC on the prevention of reoccurrence has not been studied.
And clearly some of the conclusions, speak to this. But in conclusion, an overview of the literature suggests that intermittent pneumatic compression speeds the healing and increases the number of venous leg ulcers healed by providing an environment favorable to wound healing. Improved hematologic and hemodynamic effects and reduced edema are likely the major contributors here to the healing.
Right.
Well-designed clinical studies in which IPC have been used to demonstrate healing need to be looked at, and certainly wider application of intermittent pneumatic compression in patients with venous leg ulcers requires further investigation. We certainly suggest and agree with the author that additional rigorous controlled studies are clearly warranted.
Absolutely, and hopefully this is an area that people will start looking at doing some more research in.
I think that literature is interesting.
Very interesting.
We hopefully will be joined in person in January at the Lit Crit. We hope that after a rest and delivering all those presents, clearly
Yes.
mine is in that group. He'll be with us in January. We'll
Well,
see.
we'll see him in January, and we'll see. I'm not so sure about the present, though. Didn't sound promising.
I hope you enjoyed the Literature Library.